Hi, everybody. Thanks for joining us. I'm going to give everybody, before we get started, just a minute to get logged in and jumped onto the webinar live, and we'll get going here in just about 1 to 2 minutes. Thank you, guys. All right, we'll give everybody a little bit more time, but we'll go ahead and get started with just some introductions. My name is Amy with Knight CPA Group. Welcome to session 7 of our 8-part series on the pandemic recovery webinar series that we're doing. I'm going to head it over to Charity with Healthcare Consulting to do introductions, and I'm going to go back on mute because I do have a dog. Sorry.
Thanks, Amy. Okay, we appreciate everyone being on today. We do have a brief disclaimer on the screen, so I'm going to put that up and then I'm going to just move past it. My name is Charity Farnsworth. I'm the Senior Vice President with Healthcare Consulting, and we do very much appreciate all of you being on today. What we are doing is an 8-week series on pandemic recovery, and for those of you who've been attending some of the sessions, you know that we've hit on everything from quality to compliance, financial, legal, emergency preparedness, infection control, you name it. And so we wanted to make this series pretty comprehensive as far as the types of things that agencies would be faced with. If you haven't been able to attend the previous sessions and you would like to, we do have the website shown here for our webinar series webpage, and we do post the slides for each session as well as the recording afterwards, so that you have that if you'd like to go back and look at the slides and or just watch the recording, even if you just need to go back and pick up something you missed. The sessions are listed here just so that you'll be aware of what was covered in each of the sessions. We've done session 1 through 4 in July, and then most recently we've gone over some things with regards to the FFCRA, sick leave, expanded family medical leave, the legal aspects. Amy did a bonus session on Tuesday of this week that was an added session because we had so much demand for it, talking about how to do the application for loan forgiveness. And then today we're going to be talking about addressing the pandemic psychosocial impacts while rebuilding agency operations. We know that this has been a big issue for agencies. They've been impacted across the board. And when you get down to it, that has a really big impact on the agency staff. And a lot of that extends out to patients, caregivers, and family members as well. Then we'll finish with our last scheduled session next week, talking about external opportunities for growth and expansion. And we will be talking about those topics in our final week. So for today, I'll let each presenter do their introductions as they go, but we're going to talk about beyond surviving, which is helping your agency to thrive in the post-pandemic world. Then we're going to talk about the agency operations and what some of those challenges are and what are actions that you can take in order to address those challenges. Now, it may sound like the psychosocial impacts and agency rebuilding don't necessarily link to each other, but when you consider what it can do to an agency, both from an ownership standpoint, but also from a leadership and staff perspective, and then, of course, the patients that they're trying to take care of, there is a lot of link to those. And so I think you'll see that as we go through. Now, we are going to finish with a question and answer session today. What we do ask is that with the questions and answers, if you have questions, in Zoom you have both the opportunity to use chat and then we have a Q&A function. We actually would ask that you use the Q&A function. This will make it easier for us to go back and track the questions that were answered so that we can answer them at the end of the session, but also for the purposes of trying at some point to maybe even put those out on our website in a written format. We've had hundreds of questions at this point, So we're not sure how much of that we're going to do right now, but if you'll use the Q&A functionality, that will make it a lot easier for us to track those and be able to answer them efficiently. Okay, so I'm going to turn it over to Helen and Jerry so they can introduce themselves and get started with this portion of our talk today. So.
All right, good afternoon. My name is Jerry Fenter, and I'm one of the co-owners of the Heart of Hospice LLC. We are a group that
Jerry, you guys are on mute.
That was me.
Sorry,
Okay.
there we go.
Sorry.
Okay.
Sorry, too much tech. You want me to start?
Yes, please.
Hi, welcome to Addressing the Psychosocial Impacts, Rebuilding Your Agency in the Post-Pandemic World. I'm Helen Bauer. I'm a Hospice and Palliative Care Certified RN. I am the co-owner of the Heart of Hospice LLC and the co-host of the Heart of Hospice podcast.
I'm Jerry Fenter. I am a director of spiritual counselors for a multi-site, multi-state agency. Helen and I both have about 10 years each of experience in hospice, as well as she has experience in home care. And so we are glad to be here today to present this topic to you. Other way.
So we're going to start out. Being a nurse, it's so easy for me to think of this as a plan of care. So we're going to address this topic with problems, goals, interventions, and outcomes. So we're going to start off with what do we know? What we know is the COVID-19 pandemic is accelerating the rate of burnout and compassion fatigue in community-based healthcare professionals. We already have a fairly significant rate of compassion fatigue and burnout, but the pandemic and the circumstances and consequences of it are certainly amplifying those effects. So the first thing you need to know is what's the difference between burnout and compassion fatigue? Although they look a lot alike, they are not the same thing. Burnout is a syndrome that results from chronic workplace stress that hasn't been managed well. And compassion fatigue is the strain and the emotional residue that results from working under traumatic circumstances, traumatic events, and watching other people suffering. Those two things can coexist, but they are different.
So let's talk about some of the contributing factors. What are some of the things that cause burnout and compassion fatigue? So the list that you're looking at right now is more or less something that would cause burnout. Now, these are things that are happening now during the pandemic. So what might normally cause burnout, it's still there. Now that the pandemic has hit, this is only creating more stressors that create burnout and compassion fatigue. So for instance, fear of furloughs or layoffs. Many of our teams are worried that they're not going to have a job or that they might get furloughed. Of course, that then creates some financial uncertainty. Am I going to have a job? Is the agency going to be able to financially continue to compete as they have been? What's going to happen? So those things can create extra stressors for people. And then there's just the fear that has come along with COVID. There's so many unknowns when it comes to COVID, things that we're just not sure about. How is it transmitted? Can the masks help? What can be done about it? What's going to be done about how to treat it? We're not sure. Does PPE even help? We're using the PPE, but is it really helping? Because there's people who have been able to get the virus, and even though they use PPE. And so there's so many unknowns out there. And so this fear has created an extra layer of stress on top of things. And so we're talking about PPE. Let's go ahead and mention this. There's been a lack of PPE. There's been a hard time for many agencies to have enough for their whole staff to use it. And then for some who are not clinical, such as social workers and chaplains, there's a confusion about how do I use this? When do I use it? I'm not sure how to use it. Am I using it correctly? and then the stress that comes from that. One of the things that has been added into this also is that there's been some isolation of staff out in the community. And here's what I mean by that. People see someone in scrubs out in the community, the grocery store, the convenience store, the gas station, and they get concerned because they're thinking that person who's wearing scrubs, and maybe they work in the hospital, maybe they work in a COVID unit, maybe they're coming in and to the store and they're bringing the virus with them. And so again, a lot of these unknowns have created fear in the community, and the community has sort of ostracized the healthcare workers because of that. So then all of this has created some staffing shortages. People have been getting sick. There have been staff who have been infected with the virus, and they've had to stay away for 10 to 14 days or longer. And that's created some staffing shortages. And so those who are well, who are able to go to work, well, they're overworked now because they're trying to cover not only their usual patient caseload, but somebody else's patient caseload as well. And we have to admit, it's been hard not to be able to see our patients. A lot of our staff are now using telehealth to take care of their patients, which is just not the way we were trained to do it. It's not the way that we were taught to do this. We were taught to be hands-on, and yet now with telehealth being the main connection that we have with patients, it's just not the same. And that creates another layer of stress. And early on, there was all the waivers that kept coming in week after week after week. Something new had been brought to the forefront. Things have changed. And for especially the leadership, the administrators, that was tough. And it began to create a lot of burnout. Now, the contributing factors for compassion fatigue haven't changed as much. The experiencing of multiple deaths, difficult deaths even, and for home health agencies, just the difficult patients that sometimes create burnout and compassion fatigue. So the added stressors for hospice providers during the pandemic has been this inability to be with patients during a crisis or even a death, and the added emotional stress of seeing families who couldn't be with their patients, their loved ones, at death. For home health providers, the added stressors has been patients who declined services or who discontinued their services before they were really ready to get off service. And all of that, when you knew they needed the help, but they just declined or completely discontinued services. And so all that has added to the compassion fatigue for many people. So what do we see? We see the consequences of burnout and compassion fatigue. These are some things to watch for. Employee dissatisfaction. This whole pandemic has created new ways of doing things. People say, well, we're going to get ready for the new normal. There is no new normal yet. And so what we've seen happening is that employees are becoming stressed and they become easily dissatisfied with the way things are. Nothing that we can really do to change it in leadership, but we're doing everything we can, but still has created this stress for them. Absenteeism begins to happen. People not coming to work and saying that they need some time off. They need a mental health day, for instance. And we see the absenteeism increasing, not only just in one person, but in the whole staff. That's definitely something to watch out for. And the staff turnover. We're losing staff and people who are saying, I just can't do this anymore. It's becoming too much. And so they maybe shift and do another type of work, or they just say, I'm done. Many who are close to retirement have said, I think it's time to retire now. And so they leave. That creates some instability within the team, and that's a problem. When the team is not really focused like they should have been or have been before, and it creates a lot of confusion then for the team. Watch for diminished productivity as well. When people are burnt out, when they are suffering from compassion fatigue, they are struggling just to do the very bare minimum things. And so we have to watch for them and see what's happening there. Maybe what's happening is not really their fault, other than that they're not taking care of themselves. And so we need to watch for that. One of the things that will also show up are patient and family complaints. The staff is not really doing their utmost anymore. They're struggling. The burnout has created this kind of a laissez-faire attitude, and they come in not doing their best. The patient, the family notices, and there may be some extra complaints that we haven't had before. And what it comes down to is the staff's not performing as they have been in the past, and that creates errors, and that's mistakes, and that's what we want to try to avoid. So those are some things that you might see.
Okay, we're ready for our polling question. Polling question number 1. Amy, we're going to let you manage that. Our question is, are you seeing signs of increased burnout or compassion fatigue at your agency?
So as you look at your team, what are some of the things that you're seeing? So we showed you some of the possible consequences of burnout and compassion fatigue. Are you seeing those things at your agency?
Or even in yourself?
Or even in yourself. This is true. So as you look around at your team, what are you seeing there? Are those some things that are showing up? The absenteeism, the staff turnover, the diminished productivity. Are complaints increasing? Have there been more mistakes? And we know that this is not really the way that our team operates, but due to the added stress of the pandemic, it has created some of that. So here's our results.
Ooh, nice. Okay, so very quickly. So 79% of you said yes, you are seeing. So you're looking at almost 80%. 21% said no, they are not seeing signs of increased burnout or compassion fatigue at the agency. So 80%, that's a lot.
It is. That is a lot.
If I could have voted, I would have voted yes. I told Charity, I said, this applies to all businesses, not just, you know, what you guys do. I mean, it's everywhere. It's a big deal.
It's true. We couldn't vote either, but we would have voted yes too, Amy.
Oh, absolutely.
All right. Stop share. All right. Take it over, guys.
Oh, thank you. It won't advance, Amy.
Let me just close polls altogether.
Okay.
It should just be on your slide deck.
There we go.
All right.
Okay, so there we go. What do we need to do about this? Okay, so remember, we're thinking about a plan of care for your agency, problems, goals, interventions, and outcomes. So what we need to do is we need to be able to identify the signs of burnout and compassion fatigue. You need to be knowledgeable about what that looks like. We want to mitigate the effects of burnout and compassion fatigue. You need to know what to do about it. We want to increase job satisfaction and stability, obviously, and then we want to reduce staff turnover. You want to solidify your team, unify them, and stabilize your agency.
Okay, so if we are doing this like a plan of care, I guess at this point we're really down to the interventions, things that we can do. So the first thing is you need to monitor for those signs and symptoms. Look at it, lack of communication may be there. And by the way, monitoring for signs and symptoms, that's everybody's job. It's not just leadership's job. If you care about your team, you want to watch for these things in the rest of your team. You might say, well, I'm just one of the team. That's okay. Be a part of the team, care for your team, and when you see these things happening, bring it to the attention of the leadership. So one of the things is lack of communication. People just not talking as much as they should be, not communicating with each other, which leads to poor team interaction and maybe some infighting even. People get a little snippy when people get stressed, they can get a little bit critical of each other and begin pointing out each other's mistakes. Don't let that happen. So monitor for those kinds of things. Poor job performance, just making mistakes. And again, we know this is not the way that our team normally operates, but under a great deal of stress, as it has been during the pandemic, people begin to make mistakes that they normally wouldn't make. It creates elevated emotional responses. Oh, anger. People get angry about things. Again, people who would normally not respond angrily are responding in anger. And then there are the tears. People who respond with emotion as the tears come out. And then you have those who are not on either end of that spectrum. It's not anger, it's not tears. They respond by just simply withdrawing. They don't say anything. Those are the ones you need to watch for as well, who would normally engage, but now are not engaging. Be very cautious of those. Watch for those people. If you have people who come in and they're saying, oh, I'm just so tired, I just can't seem to sleep at night. Well, insomnia can be a problem. I know how it is for me at times. The things that happen during the day, when I lay my head on the pillow at night, just all the things that happen during the day begin to spin in my head and can make sleep very difficult. That's what can happen during times like this. And so if they come to work tired, watch for that. Addictive behaviors begin to also increase during a time of added stress. Things like substance abuse, gambling, shopping, pornography, and overeating. So watch for those things. I can say that I have seen this actually begin to happen to some of my team. I lead a team of over 40 chaplains, and we have seen some of this actually occur. So watch for those things. Increased absenteeism. They just at that point where they're struggling to get to work every day. Maybe they're coming in later. I can tell you from personal experience, I had a coworker, a nurse, who was always on time. In fact, she was getting there way before anybody else would. And then all of a sudden, I began to notice that she started showing up 15 minutes late, 15 to 20 minutes late every day. And I knew something was wrong. Something had changed. And sure enough, there was a lot of burnout that was happening in her life. Forgetfulness. When a person's mind is full of all kinds of worries, concerns, fears, they tend to forget things more often. And so if they tell you, oh, I just completely forgot to do that thing, well, that could be something that's a sign that they are suffering from burnout or compassion fatigue. And then there's apathy and cynicism, the I don't care anymore attitude. That one is definitely bad, and you should watch for that. Those who just say, you know what, I really don't, it doesn't matter to me. You need to watch for those kinds of words coming out of people's mouths. It can be a sign that there's a problem. So here's a self-assessment tool that we would recommend. It's the Professional Quality of Life Survey Assessment. Now, some of you may have taken this assessment before, and that's good. You know how it works. There's 30 questions that are on this assessment, and they score from 1 to 5 each. Now, the items are really based on the last 30 days. So when you say you've taken it before, that's great. You should take it again if you haven't taken it within the past 30 days. It's not a one and done. It's not like taking a personality test where you take the test and, okay, you figured out your personality. Hopefully your personality hasn't changed over the past year or so. But this self-assessment tool is one that should be taken more often than that. In fact, they're going to ask you to judge your assessment based on the past 30 days. So take the test. Even if you've taken it before, take it again, because seasons change, people change, circumstances change, and it changes the stressors that happen in our lives. So the assessment is free. Thankfully, you can go to the link that we provided there on the page, and you can actually use it for free. You can print it off. As long as you credit the author and no changes are made, you can print that off and give it to your team and let them use it as well. And so we would encourage you to use this tool.
So another suggestion we have for you for creating some self-care for your team is to create a meditation space inside your office. It's easy to do. It doesn't have to be a big room, a full office. It could be just in a cubicle. You could even take a pressure rod and put a curtain across it just to section it off to allow for some privacy. But if you create a space like this inside your office, we encourage you to think about the 5 senses. You can start with a diffuser with essential oils for the sense of smell. The oils that are great for this are thieves, rosewood, cedarwood, frankincense, and lavender, all very calming, very soothing smells. And then for taste, you could put out a bowl of oranges, berries, peppermints, pumpkin seeds. Pumpkin seeds actually are a really good source of magnesium, which is known to cause a calming effect in the brain. Walnuts, peppermints, and dark chocolate. Of course, you have to have a little bit of dark chocolate. Images, the colors in your space that you decorate with, posters or paint, whatever you might use, colors that promote calm and lift the spirit, blues, yellows, and greens, things like that. And then for the sense of hearing, soft reflective music based on the culture of your team, the beliefs and the culture inside your office. You could use either sacred music or secular, depending on what's appropriate. Just make sure it's appropriate for everybody on your team so anybody could feel comfortable accessing your meditation space. And then for the sense of touch, you can use stress balls or worry stones, aromatherapy heat packs, squeezable putty. I remember when I had a real office before I worked at home, I had stress balls that different vendors had given me, and I always took one, and I had a little row of them, and that's what I would use to let my stress out during the day. And for you hospice agencies, this is a great way to get your hospice volunteers to accumulate some hours if they're unable to see patients or not willing to see patients, for them to flex their creative muscle a little bit and create a meditative space. You could use those volunteer hours. And for your home health folks, if you're having to repurpose some of your staff right now, this would be a good a job for somebody who's been having to be repurposed and maybe needs a little something extra to do, and it would create some ownership on a part of your team.
Okay, so let's talk some more about self-care for your team. Not only a meditation space, but how about just doing some self-care with the team as a group? So one of the things that you could consider is having a mindfulness moment to open or close your meetings, whether it's an IDT meeting or a Friday, check-in meeting at the end of the week, something like that. Just a mindfulness moment with your team. Here's one suggestion that we would like to give to you is what we call a 3-2-1 mindfulness exercise. And you can have them write it down, or if it's a small group and you just want them to share out loud, that's fine too. But here's the way this works. First of all, ask them to name 3 things that they see. Now that might seem kind of odd. I mean, you're sitting in a conference room or something and ask them to say, name 3 things that you see. But one of the things that people will do to help maybe someone with PTSD to become a little bit more grounded in the moment is they'll ask them to just start naming things in the room that they see. So when you ask them to name 3 things that you see, you're asking them to come back to the present moment. And that's a good thing, is to help them connect with the now. So name 3 things that you see is the first thing. And then you say, okay, name 2 things that you hear. And at this point, you can even ask them to close their eyes and just have them really focus in on what they're hearing. So name 2 things that you hear, and then have them write those down or say them out loud. And then the last thing is to say, okay, name 1 sensation that you're experiencing right now, and have them, again, write that down or say that out loud. All of this to just help them to become present in the moment, present with themselves at the moment. It's just a mindfulness exercise. And so there are a lot more mindfulness exercises out there, or meditation moments that you can use with them. Really try to include as much connection as possible. If it's possible for you to meet in person in a large enough room where you can social distance, that's great. Or if nothing else, at least have a video meeting with them. Try as much as possible to not just have a conference call over the phone where all they're hearing is just a voice. If you can have that visual connection, it really does help. We know if we've been using telehealth, how much that actually is much better than just a phone call. So have them in person if you can, but have them on video if possible. So it kind of helps to promote connection and offset those feelings of isolation that staff have at this time. So also do a staff survey. This is one of the things that I actually do with all of my team is I have a staff survey. When I'll ask them, what is your high for this week? What was the best thing that happened to you this week? Then I'll also say, so what was your low for the week? And then I'll ask them for the status of their personal morale, and then what they think is the team morale. How is it going? It kind of use a 1-to-5 ratio there, so that they can answer that. And to also talk about, what's their workload like? Has it been too heavy? Has it been okay? Has it been really good? Then, as time goes by, as week to week goes by, you can kind of see a pattern. Plus, if you look at the individual surveys, you begin to notice when someone's beginning to have some problems. If they normally would answer a 5 for their personal morale, and all of a sudden the next week they're answering a 2, that might be a cue that there's a problem you might want to check into. We would also encourage you to invite an LPC, a mental health professional, to come to be with your team and to do some exercises with your team. Someone who is not on your team. Many times the social workers or the chaplains are encouraged to do this with the team. But remember that they are part of the team. So let them be part of the team sometimes. So invite someone else, like an LPC, to come in and do some self-care exercises with your team. It can really help. But also encourage you, if you can, to use some of the online counseling services that are available, such as Ginger and Talkspace. We're not necessarily recommending these, but those are available if you would like to use those.
Okay, Amy's going to put another polling question up for us.
So the polling question this time is, has your agency provided any new or additional resources to support the psychosocial needs of your team? So since the pandemic has started, is there anything new that your agency is doing to kind of help the team, to encourage the team and support them? We would love to be able to find out what you've been doing, but just at this point, just answer yes or no to the polling question. Is there anything new that your agency is doing to help the team?
I really would hope that we would have the kind of score that we did on the other polling question that we had, 80% say that they had their agency was adding in resources.
Right. So it's always good to think creatively, and certainly the pandemic is one of those things that has forced us almost to be creative in the way that we do things. I mean, the telehealth and all of that.
Okay, so the results are in. So 53% of you said that yes, your agency has provided new resources to support the psychosocial needs of your team. 48% of you said no, they haven't. So
encouragement to maybe be creative and find ways to support your team in some way. And hopefully some of the things that we invited you to do or encouraged you to do, you might be able to integrate that into your agency.
All right.
Okay.
Are your slides good? Let's see.
You might have to turn off the polling.
I did.
I think so, Amy.
It's off. I wonder if it's just kind of delayed.
It might be. We're still clicking. Charity, we may need to get you the screen
yeah,
share.
so why don't I do this? Why don't I share my screen? And y'all give me just a moment. Let me share my screen.
Let's see.
Give me one moment, and I will share, and then we will start where you would normally be going back to. Hold on just a moment.
Thank you.
You are welcome. How's that?
Good.
Perfect. Thank you.
Awesome.
You're welcome.
Awesome. Okay, so what can leadership do? And what we would remind you of is everybody is a leader, whether you're a formal leader recognized with a title, job title, credentials, etc., or you're an informal leader. Everybody has an opportunity and an influence when it comes to the morale of the people that you work with. So the first thing we would recommend is that you model healthy self-care. Nurses are notorious for, what did we say? Do as I say, not as I do.
Exactly. Or as we say in the spiritual world, practice what you preach.
Yeah, practice what you preach. So we would recommend that you model healthy self-care. Promote healthy habits among your team. You know, the easy fix isn't always the healthiest one. Those pizza parties aren't necessarily the best thing for your team to get them together or to provide a healthy meal for them. We also would encourage you to remind your employees that if you have an employee assistance program, an EAP, that's available to them for assistance of whatever form that your agency might provide. You want to make sure that you remind your employees, your team members, that that's there. Use positive language, realistic optimism. We all know that what you say matters, whether you're, again, a formal leader or an informal leader. Realistic optimism is really the language we ought to be using right now. We know there are challenges. We know we're in an unprecedented situation in healthcare, but we also have technology, we have techniques, we have innovations, we have innovative leadership in our industries that can help us figure out what to do. So use the positive, use the good words. Be as transparent as possible. We understand there are sensitive decisions, financial information that you're not going to share with your entire team if you're a formal leader, but be as transparent as you can. People want to feel confident and they want to feel informed. So communicate is so important. And stay connected with your team, be accessible, be available for questions if people need to talk. Those surveys are a great way to interact with your team, get their feedback, and then you can find out where there's a need. So we would really encourage you, I guess you could really just put one word on this slide, it would be communicate.
Okay, next slide. All right, so how are we going to know whether or not it's working? This is the outcome portion of the plan of care. So monitoring the outcomes. Keep doing those surveys. Keep doing those surveys. You will hopefully see an increase in satisfaction if you're actually engaging and proactively providing your team with some resources, encouraging self-care. Hopefully you're going to see an increase in their satisfaction, and that's one of the things we want. And where there's an increase in satisfaction, there's typically going to be less turnover. There's going to be so many benefits that come from that. And so engaging with your team and encouraging self-care and providing self-care for them are definite ways of improving those surveys. So continue to assess the level of staff participation. Are they engaged in the self-care activities? Are they using the meditation space? Just watch for those things. And of course, the human resource metrics, the turnover rate and things like that, watch those numbers as you always do. People can also be very honest when it comes to exit interviews. They get to be really honest at exit interviews sometimes, but listen to those. They sometimes tell us things that they wouldn't tell us otherwise, and it really does open up our eyes to things that might need to change. And so what it comes down to is just ask. Just ask your team. Find out how they're doing. Find out what they need, and be flexible. Be creative as well.
Okay, next slide. So in conclusion, we would tell you guys, we've been doing this all along. We've always had burnout and compassion fatigue issues with community-based care, the professionals that work in these industries. But we would tell you in this situation, this is a marathon, not a sprint. It's so important that you care for your team, care for yourself, care for your agency. And we would also remind you, I've come to hate the word non-essential. Everybody on your team is essential. Everybody, no matter what your role is, your credentialing, your job title, everybody is essential.
Absolutely. We appreciate you being a part of this webinar today. Thank you for allowing us to be here with you, and thank you for letting the Heart of Hospice share with you today. And so right now we're going to turn it over to Heidi.
Good afternoon, everybody. I'm Heidi Wall. I am the Director of Hospice Consulting for Healthcare ConsultLink. And so rolling along with the theme of plan of care, and I love that, and I actually thought about that myself. I'm going to be talking about the challenges, which is like the assessment part of the plan of care of your agency. When I talk about challenges, they've talked a lot about the staff and the psychosocial aspects of being a leader in your organization, no matter who you are. But we're going to talk a little bit more in depth about some operations kind of challenges that we have here. So we're going to talk about what has your agency experienced. So first of all, when we talk about agency challenges, one of the things is the decline in program census. More agencies than not have seen a decline. There are some who have seen an increase, and I have talked with some of those, but for the most part, even if they have, they're the short length of stay. Patients come from the hospital, they're on service less than 7 days, and it's a real churn and burn kind of situation. But the reason that part of that decline in the program census is there's a difficulty we've been experiencing, or hospices have, and home health, of accessing patients and families and facilities, including family members. The facilities have said, no, we've got to protect our patients. We can't let you in. And it's very unfortunate. And it's resulted in a lot of, even when we talk about compassion fatigue, when you can't see those patients, all you can do is see them on the screen or talk to them on the phone or see them through a window. It's just not the same. And when you're not in the facility, you are not visible. You're not being seen. As far as, for other referrals and for, family members who say, hey, I see you in here, so-and-so, seeing Mrs. Jones every day, and she seems really happy with your services. Maybe my mom could benefit from it, but we're not getting that opportunity like we usually do. Decline in access to patients at home due to anxiety surrounding the pandemic. A lot of patients and families are concerned, if you come in my home, like they were talking about with the scrubs, if you come in my home, you might be bringing germs in here, and you're out in the community, you're probably going to the grocery store. And so they're very anxious and don't want you to come in and, give me a call or we'll do the telehealth. But again, not being in the home. And so, as far as, the satisfaction level, it's not quite there. Gaps in the utilization of hospice resulting in short length of stay. Like I said, we're getting patients from the hospital that are, late in, they're at the end of their lives, less than 7 days often. And that's a real challenge as far as getting in there and getting those patients home. Everything has to happen so quickly. There's not the time to really do everything like you're used to doing, and making yourself visible in the hospital to get, to actually show what we do and get those referrals. There's a temporary halt to elective surgical procedures impacting home health services. A lot of them, they're not getting the referrals they need post-surgical, for especially orthopedic surgeries. It's just, there's been such a slowdown in the elective surgeries that it's just not happening for home health. So they have that census drop. The attendant services for PAS service clients declining, and the caregiver, caregivers are stepping in as possible to help out. They don't necessarily want people in their homes either, again, due to the anxiety. There's a reluctance to accept referred patients based on staffing challenges. I have talked with agencies that said, we're getting these referrals, but I have such a turnover, as we were talking about, and I don't have the staff to take care of these patients, and I'm really concerned about that. Or, you may anticipate that next week I probably won't have the staff. Last week I didn't, today I do, but tomorrow I won't, because it's such a changing environment. So there's some reluctance there, and sometimes referral sources can sense that reluctance as well. And then the direct contact with referral partners, out of sight, out of mind. Again, if you're not in the hospital, you're not out there, the marketers, your marketers aren't out there being able to meet face-to-face with folks, because we're just decline that in general in our society. There's just not that face-to-face contact like there was. And so, people are busy, focusing on infection prevention and not looking out for things that, out of sight, out of mind is what's happening with home health and hospice. And so the decline in revenue stream and profitability has resulted because of that decline in referrals. The census is declining, the revenue stream isn't there. And then, we're concerned about our profit. What's going to happen at the end of the year when we set up our next budget. some of the things that we do see, the unbudgeted costs that we have this year. We didn't all budget for this PPE. It wasn't in our budget, and we're spending a whole lot of money for that. And the cleaning supplies, all the things that we have to use to address this contagion. The computer equipment to accommodate the remote work from home arrangements, or even the situations with setting up telehealth, things like that. That's expensive. Contract labor, you may have had to use contract labor, and that's, a cost that you probably didn't factor in your budget. Office space and office furniture to ensure social distancing. Maybe, you're having to move desks around, and maybe you have to actually use, buy some more furniture to move some things around, or you have to, expand your office space. That's a possibility. For hospice, there's the loss of the service intensity add-on, and it's not completely lost, I'm sure, and hopefully not. But there a lot of times, even at the end of life, if you're not doing those 3-day or 7-day visits, you're not getting that higher reimbursement level, and so that's affected your bottom line. Higher per patient day costs for medication, supplies, equipment for the COVID patients that you are taking on. That the medications and supplies. Maybe you're having to put more supplies into the home because they don't want you to come out as often to deliver them, and so you're having to what we used to do with like a 2-week supply, maybe you're doing a month's supply at this point. The increase in LUPA, low utilization payment adjustments in home health for LUPAs, that's being affected definitely. With this situation, and a decrease in attendant hours due to the limited access in many cases to get into those homes. So those people do not have work. You're not getting the revenue from that. And then the operational disruptions that we see, the previous marketing strategies are no longer effective. Going into a nursing facility, and I used to have a marketer that loved to bring Starburst out to everyone in the facility. And they'd say, here comes the Starburst man. But, they love to see him. And almost every time he went in, he got, and got a referral or two from them because he was there. It was not the out of sight, out of mind. It's like, oh yeah, I think I have a patient that could benefit from your services. So those strategies aren't effective anymore. Routine educational opportunities are limited. You're not seeing your staff as much. You don't have those monthly staff meetings, weekly staff meetings anymore. Maybe you are not able to send people to conferences like you could before because they don't exist. They're virtual and people don't always have time to do that. You may have found that you have some inadequate policies and procedures in place to address the infection prevention techniques that we're talking about, or the emergency preparedness plans. And that you realize that, we have to have some sort of pandemic policy in place and those things. Daily operational activities have additional focus now. Now that we are in the pandemic, there's daily screenings of staff, and patients, and clients. And this is time consuming, and this takes someone dedicated to do that. Staying on top of the latest PHE news, making sure that, how many different links do you have on your computer now that you need to go to and check every day to make sure you're not missing anything. Ensuring that your EPP is up to date, compliant, and adequate. Are you documenting all the things that you're doing to keep your staff safe and to address anything that's changed during this pandemic, to keep your patients safe? Staff challenges to meet patient and client needs. There's so many of these now, and we just talked a lot about those. This is taking up more time, even monitoring your staff for that compassion fatigue that Helen and Jerry were talking about. That does take time, but it's much needed. Focus on infection prevention activities all the time now. Even our QAPI now has to be focused on infection prevention. So this is an extra step that we have to go through. It's needed, but it does take time. So there's a lot of disruption in your operations. Increased focus on documentation, related to the pandemic. This would be, documentation about your screenings for the patients and families, your screenings for the staff. How do you document telehealth visits? This is all a challenge. This is all something that takes longer to document in those particular cases. And then there's some clinical impacts as well. We found with agency challenges, concerns for the safety of your staff and the patients and clients, their safety for, are we going to how to keep them well, how to keep them being able to come to work. And then when we talk about wellness, we're talking about the physical as well as the psychosocial part of that. And how are we keeping our patients and clients well and making sure that we're not, spreading anything out there, ensuring the competency in PPE donning and doffing. And like Jerry was talking about, there's a lot of, especially not nurses, who don't know how to do that. We have to make sure that they are competent and they do know how to put on their gown and gloves and what order they put that in. And then competency and documentation focus on infection prevention. How are they, when they do get into that home and someone says, hey, my sister's here and she just tested positive for COVID, do they know what to do next? These are all things that have impacted the daily life of a hospice or home health clinician. And then the utilization of skills to address fears and anxieties of the staff. This kind of fear, a lot of times, I know I can say for hospice, a lot of times we heard, oh, it's too early for hospice. That was the biggest objection we heard was, it just doesn't need hospice right now. We're not ready yet. Well, now what we're seeing even more are the fears and anxiety of getting the virus, of someone coming into my home and bringing it in here. So the ability of the staff, to be able to address those fears and anxieties, that's a whole nother level for them as far as how to approach that. And then, there probably is some anxiety or another level for some on the audiovisual equipment. We had a little bit, some challenges even today. Can you imagine your staff out there having challenges with trying to make sure that that works well and that we are instilling confidence in our patients? Staying informed regarding changes in procedures. We've talked a little bit about that already, how to address those related aspects of care. What does the CDC say today? It isn't the same as what they said yesterday, and it probably won't be the same as tomorrow. It changes all the time, and we want to stay on top of that. Staffing shortages, again, just what Jerry and Helen were talking about: fatigue, burnout, errors in care and judgment, absenteeism. Admitting short length of stay patients, that's a big one. Whenever that happens in hospice, 28% of all, for years now, it's 28 to 30% of all patients on hospice are less than 7 days. And now that's even increased even more. So the effects of that admitting a patient, all that intense work and teaching in the beginning, and then they die within 7 days is really, really difficult for your staff. So. And now I'd like to introduce Charity, who's, since we talked about the assessment part of the plan of care, she's going to talk about the interventions or the actions that you can take with your agency. So thank you, Charity.
Exactly. Absolutely. So of course, now that we know what some of the challenges are, we have to look at what are we going to do to try to get those back on track. Those operational processes that are related to those challenges and or just addressing the challenge overall. So, the first thing that you have to do is ask, what can you do to make sure that your business is still viable and it's growing? One of the things that we have to think about is with COVID, we've seen agencies see a decline from where they started at the beginning of the year. So we're just in a way trying to get back to that 0 mark before we can even grow above and beyond where the agency was to start. And I'm sure everyone had their year planned based off what they expected to do from a business standpoint. Well, we know that that's been impacted for agencies of all sizes. So it's a matter of how do you recoup that and then also try to grow above and beyond that, which was likely going to be your goal for this year anyway. Now, I think it's very important to think as we go through this also that census does not necessarily equal profitability. And the reason that I say that is that when you look at it, it's important to remember that it's not just about adding patients or clients. You can add patients and clients all day long, but if you can't do that in a manner that results in profitability because you're managing your operations appropriately, then in a way you're almost treading water. We are, even not-for-profit agencies are in a position where they have to be able to manage their operations appropriately in order to come out in the black, because if they don't, they won't be able to continue providing care for very long. That's one of the things we have to think about is whether you're for-profit or not-for-profit, there's still a light bill. There's still staffing costs. And what you don't want to see is that you end up in a situation where you have to actually cut back on your staff or cut back on some of the services that you're providing because of the fact that you're not profitable enough to be able to continue doing what you were doing before, because all that does is make it harder for you to care for the patients that you are trying to provide care for. So let's talk about some of the things that you want to look at whenever you're talking about the decline in program census. So look at what your marketing strategies are. You know, you want to focus on referral partners and their need to minimize the risk to the most fragile and vulnerable patients. You know, these are the patients that, you know, Heidi referred to it, Helen and Jerry referred to it. You know, these are patients that they have fears about being exposed, and they're patients that if they're out and about in places like waiting rooms, hospitals, urgent care settings, emergency rooms, you know, they are going to be more likely to pick up the virus and become infected, or it may be even just them going out and, you know, doing other activities like trying to go to outpatient, outpatient therapy, things like that. If they are the types of patients that would normally qualify for home care, those are the types of patients that we want to look at. What's our opportunity to get to more of those patients so that we can keep them out of those settings? And we also want to look at how are we marketing our business and how can we do that maybe through phone calls, text, email, video conferencing, webinars, and virtual events instead of it having to all be in person. This is where that phrase that everybody hates to hear because it's so cliched of thinking out of the box comes in, because we really have to change the way that we're thinking this year. You know, and who knows, you may find that you're able to do just as good a job, if not a better job, and get better reach through some new marketing strategies that you can continue after 2020, and they may even be less, less costly for you, and they may reach a wider audience, for the same or less money than what you've been spending. You also want to look at increasing the focus on the benefits of care, providing care in the home. You know, one of the things that we talk about anytime we market home care services is how much more cost effective it is to do that instead of providing care in a lot of other settings. Those other settings are the very places where patients are likely to be at higher risk for infection exposure. So by making that a part of your messaging, if you haven't already been doing that, and talking about the added benefit of minimizing the risk to exposure, then I think you're going to see an improvement in your response to that as well. Then you want to look at specific patient populations that may be more at risk and look at ways to reach them. I referenced them in the first bullet point, but I'm talking about patients that, you know, maybe they are just more at risk because of the certain types of health conditions that they have. You know, maybe they're more at risk because of the setting where they live and the fact that they may have more people coming in and out, for example, that could expose them. You know, then you want to look at where the referral sources and who would be involved in providing the referrals for those patients if we were able to try to reach them. So those are some things to think about. Now, you also have to think about promoting that trust and that respect with your referral partners. You know, we know that referral partners are going to refer to agencies that they feel, for one, can do a great job of caring for the patient, but that they also have a level of trust in. You know, no one wants to be that person who sends someone to do business with another entity or agency or whatever, only to find out that they didn't get good care, because who are they going to come back and say, can't believe you referred me to them. They really didn't do a very good job. Whatever service is being provided, if that service is not done well, then that goes back in a way to the person who made the referral, because that raises the question of, do you really know them well enough to make referrals and say they can do well? You want to go in and talk with your referral partners and validate their concerns about patient safety. You know, this is an opportunity to review your admission process and talk about what are you doing to protect the patients that they are sending to you. You know, talk about how you can support them. You know, talk about, here's what we can do for the patient, you know, by sharing our resources for PPE. You know, let's talk about how we've updated our policies and our procedures to make sure that we are doing the necessary steps to protect the patients, you know, and make sure that both to your referral sources as well as the patients, they know that you're going to communicate out the most updated information about the public health emergency. You know, that's been one of the biggest challenges, and I'll say this from a healthcare consultant standpoint. You know, we have policy manuals, and we've been updating those, and we've been putting out documents that talk about recommendations for things to do to keep up with CDC guidelines, in your agency. Well, that is all changing so quickly, that even those of us who do that as a part of our everyday business have to have specific individuals who are designated to monitor those types of things, because especially, for the first 3 months or so, this has been new information every week. It was new waivers, like Helen and Jerry referred to. It's been new information about the do's and the don'ts and what they're finding out helps or doesn't help. And so those are the types of things that if you're communicating to your referral partners, here's what we're doing, here's the information that we have, we want to make sure you have it, and let us be a resource for you. I think that will make a difference to promote trust and respect also. You also want to make sure that you're providing assurance that your agency hasn't made cutbacks that are going to impact patient or client care, and specifically that the same quality of care and compassion remains. When we talk about making cutbacks, we know that if you have to cut back staff because you can't afford to keep the staff, something has to give. Either the other staff have to pick up more patients, or you have to end up, letting patients get discharged from service because of the fact that you don't have the people to care for them. So it's a double-edged sword in that way. So you want to make sure that they know we are still going to be able to provide the same level of care. We're still going to be able to do that while protecting the patient, and we're going to make sure that we are respecting the patient and their concerns, and that we're being compassionate to the stresses that are involved both for them as well as the caregivers. Then you also want to look at opportunities to provide virtual education and counseling to physician office and facility staff. They are in this just like the rest of us. And think about facility staff. If you have an assisted living facility, for example, and that assisted living facility has 50 residents living there, they have 50 individuals whose family members have in some way entrusted their care to them to make sure that they stay safe. That's part of the reason that you move a family member to an assisted living facility. Well, there's a high level of stress involved with that, especially if they had previously had family members or other caregivers coming in to support them, and access to the facility has been limited. Well, that only leaves the facility staff to be able to provide that same care. So that's going to be wearing on them, and they may be losing patients to that as well. So if they're losing patients, that's going to have an impact on them, and the bereavement counseling and education might come in very beneficial for them. Then you also want to look at focusing on demonstrating that working with your agency will give them that add that a referral partner is looking for. You can take 10 home health agencies or 10 hospices or 10 PAS agencies, put them all side by side, and every single one of them can provide good care, and they can promise that they can provide good care and back that up. But what makes that differentiation between those is what other things are they doing to be more of a value to the referral source versus just coming in and going, what do you have for me today? I used to work in operations, and I had an account executive that, early on in his career, he would walk in and the first thing out of his mouth would be to say hello, and then he would say, well, what do y'all have for me today? That's an all about me type approach to marketing. This is not only about what do you have for the agency that, we can do to admit patients. It's, and what am I going to do as an agency to help support what you're doing to the patient so that we can work together to make sure that that patient is well taken care of. So those are some of the things that I think, would also help with your referral sources. Also, when looking at program census, you want to look at what's your current marketing approach and how do you regrow that census and expand it. We've talked about looking at your referral sources and having different conversations with them, but look at what the patterns were in your referral source activity before. Look at what you've been doing already, with marketing to those, and adjust accordingly. For example, what's different under this health emergency that we now need a new or different approach? It may be that access, assessing the limitations to marketing to those usual referral sources is something that's going to be a key part. If you can't get into the facility, if you can't get in to see the physician, or the physician is not even coming to their office, then you're not going to be able to do the same thing and expect the same result. What's the old joke? It's the definition of insanity to keep doing the same thing over and over again and expecting a different response. I think we are living in 2020 in some version of insanity. You know, I mean, I think I'm pretty sure most people are ready for this year to be completely over with at this point. And I'm on that list, you know, but I think that we can't expect to do the same thing over and over again and expect that it's going to be the same in the environment that we're in. This is also that opportunity to look at coordinating with either strategic partners or other groups that you can say, okay, how are we going to do business differently in the current environment? This may be visiting physician groups, it may be these transition physician groups, or it may be those that are really embracing the use of telemedicine. You know, about a month into COVID, I actually had a telehealth visit with one of my physicians. And I have to admit, I've been in healthcare for many years, and even for me, that was an odd experience. It just felt very strange, you know, to be sitting there doing that. But my doctor in this case had really embraced early on that the only way to take care of his patients with everything locked down like it was in April was to embrace telemedicine. And a lot of those physicians have done that. They're trying to keep their patients under care and make sure they have what they need. And I think, you know, those who have embraced it early on and who are doing it on a regular basis are going to be physicians who are also looking for providers who can coordinate with them, you know, to make sure that that pattern continues. Then you also want to look at, are there those patient or client types that you previously may not have even targeted for providing care? You know, maybe you didn't look for those types of patients because you either weren't staffed to do it, or maybe that just really wasn't the niche that you wanted to be a part of. Well, if you haven't been able to get in and do visits for certain types of patients and you need to look at another group of patients that could be an opportunity for you, now is the time to do it, and you may find that you actually want to continue providing care to those patients moving forward. Now, Heidi touched on, you know, the things that are causing declines in the revenue stream and profitability. I think you need to, as a whole, look at what is your return on investment measurement process when you look at any target groups for your marketing efforts. You know, you need to ask, can we be profitable with our current structure and our current focus? You know, that's one of the things that in healthcare, you know, we don't directly measure, you know, the return on investment for caring for patients, but that doesn't mean that you don't look at where are you spending your marketing dollars and are you seeing an overall agency impact. You never want to link that to a specific patient, you know, because what you want to do is you want to look at your agency as a whole and how you are looking at your marketing as a part of the agency operations. Then you want to look at, do you have the opportunity, you know, to consider options for additional revenue streams? For example, if you are, you know, maybe you have 2 or 3 service lines on your actual license, but you've only been providing care under one of those service lines, is this an opportunity to do that? You know, at HCL, we get a lot of questions from people who say, you know, I have had, maybe they do licensed and certified and they haven't done PAS in the past, but they have it on their license. You know, what would it take for me to start providing care under that service line? Because I'm already one step in that direction and I just need to know, you know, is this something where I could get it off the ground and maybe help to cushion, you know, if I'm seeing losses in the other area. Then you also want to look at, you know, of the service lines that you're providing, what is the, which ones of those have had the least amount of impact, and do you maybe want to put more focus on that particular service line for right now to continue to grow your agency while you're working to get the other service line back on track? So I think that's some of the things, you know, looking at service lines that you would want to consider. Then you also want to look at how are we potentially losing revenue with our current patients? You know, review the process for tracking the visits and, you know, the time that you are, you know, providing care for those patients to try to minimize the miss and reduce visit counts. You know, looking at, you know, do we have level of care changes? Do we have reduced attendant hours? And what can we do to try to minimize the impact of those? Part of that is that big bullet point of communication. You know, if your staff are nervous about making visits or going and taking care of their PAS clients and they are not, they're giving you reasons why they can't do that, I think you need to find out, is that a staff concern or is that a legitimate issue with the client or patient where we just can't go in there to provide care? Then you need to look at how do we review the use of telehealth to try to balance providing services, especially if telehealth visits are not billable. You know, we know that we're allowed to use telehealth, and I think that's a great adjunct to anybody's services, but you have to look at, you can't just go and replace every visit with a telehealth visit in the home care setting, because we won't be able to get paid for those visits. So while they're an adjunct and they can absolutely help with the plan of care, you also have to look at that you can't go do all those visits via telehealth, or you won't make any money, okay? Other things to consider is looking at how do you have shared cost savings when possible for some of your supplies like PPE, cleaning supplies, IT equipment. You know, even before this hit, when we were talking, you know, I did a lot of PDGM training for home care agencies last year, and we talked about, for smaller agencies in particular, how do you get into group purchasing settings where you can get buying power for some of the things that you need, but you don't have to be a large agency to have a formulary, or you don't have to have a large agency in order to have better purchasing opportunities for some of the things that we're talking about. This would be another time when you might be able to take advantage of something like that. Then you also want to look at what government funds have been available and access those resources, but also make sure that you know how to be compliant with them. That's one of the things that we've done in several sessions in this webinar series, is to talk about the different programs, both from an accounting, financial, and legal aspect, but also how to be compliant with making sure you're doing what you need to utilize those funds and document that you're doing it properly. If you weren't able to attend those sessions, I strongly encourage you to go back and look at those sessions and look at the materials provided with them, because you really want to make sure that you are not being non-compliant without even realizing it, because these could be the things that help your agency to stay in a good position moving forward until you can get back on your feet. Providing education and coaching to the staff is also important. How do you make sure that those patients, clients, and their family have confidence in your ability to keep people safe? And then reallocating savings, you know, to increase your medication, supplies, and equipment costs whenever appropriate. You know, if you're not out and about seeing patients as much, you should see a decline in your mileage and travel expenses. Well, if you have that money available, see if you can use that in other areas to make sure that you are out putting the money where it's really needed and minimizing the additional cost if you can just move it from one place to another. Very importantly, though, look at your expenses on a weekly and monthly basis. You know, we look at financials every month for our own company, and I have to tell you, you know, you don't want to be in that situation where you say, wow, it took us, you know, 2 weeks after the end of the month potentially to get everything pulled together, and this is what happened the middle of last month. Well, we're already halfway through the next month. Are we going to be able to really fix that for the current month? Probably not as quickly as we could have if we were looking at it on an ongoing basis. That's how you get ahead of it versus always being reactive. Then looking at how do you optimize your staff productivity when you may have potential shortages. Those shortages may be because someone's in quarantine. It may be because someone's child, you know, doesn't have a place to go for their child care, and they simply can't work because that's their only way to get care for their child. Those are the types of things that you have to look at from a productivity standpoint. Now, from an operational disruption standpoint, look for opportunities to have free online education. You know, things like what we're doing right now. It doesn't have to be our webinars. It may be that there are other webinars out there that hit on the things that you're looking for that may be staff specific, and those would be some opportunities for you to get that free online education for your staff. Also looking at how do you stagger your staff in office time to try to take advantage of the space you have and the equipment that you have without having to go out and spend any more money social distancing in the office and doing things like that. You know, the remote work from home approach has made a big difference for a lot of people. There are certain positions you can do that in, and there are others that you probably just can't. But maximizing your opportunities to try to, you know, have staff sharing space or trading off who's there when, you know, can make a difference. The next bullet point hits on one important thing, though, is make sure that you have appropriate cleaning processes and staff in place. You know, if you have staff who are sharing spaces, maybe one of them comes in Monday, Wednesday, Friday this week, and Tuesday, Thursday next week, and they share the same space. That's great, but they're also sharing the same space. So make sure that you have cleaning processes in place to protect them in the event that they're sharing the space and one of them may have the exposure to the virus. You know, you want to look at how can you potentially outsource things like your policy and procedure updates. if you've been writing your own policies and looking at your own procedures, or even things like writing your own emergency preparedness plans, if you don't have the capacity to do that and do that well right now, even if you only do it temporarily, this is an opportunity to outsource that to make sure that you have what you need and that it's compliant, but at the same time, let you focus on the things that you need to focus on that you cannot outsource. You also want to network with other program providers and referral partners to look at what are the best practices for infection prevention. We know that the CDC has put out recommendations that everyone can use, but you have to look at agency-specific ones also that may be dependent upon the types of patients you're caring for, the locations of those patients as far as the care settings, and things like that that you have to consider. Then you also want to look at, do you designate specific staff or even volunteers, like Heidi talked about, to track the patients and caregivers screenings as well as staff screenings, and also to monitor for PHE updates. Now, you know, we used the term in a previous one of our sessions about the COVID champion. I don't know if some people would necessarily like that title, but they can be your COVID champion. They can be that person that holds the primary responsibility for knowing what's going on, monitoring for changes, making sure those tracking tools are being completed so that when you do end up in a survey or an infection control focused audit, you have what you need and you can show you have a person who was designated to do that. They knew what they were doing, they were staying on top of things, and they were making sure that the documentation was done, which is hugely important. Now, you also want to look at how do you improve your processes from the point of intake to admission and then further along. You know, are you getting adequate information at the time of admission? This might be, did you get what you needed for a face-to-face? Because we know that face-to-face appointments are more difficult to get right now. You know, I was just on a call with a client earlier today where we talked about how patients who, for example, in home health, who are admitted without their face-to-face encounter completed, well, you have 30 days to get that done from the point of admission, but what happens when their physician is not coming into the office regularly? And what happens when their physician is not doing telehealth? If you can't make sure that you have those things or that you have a good plan for it, you may not be able to get what you need to continue caring for the patient, and anything you've spent caring for the patient is not going to be covered because you won't get paid what you would normally expect for that patient. Then you also want to look at, will you have other physicians or non-physician practitioners involved in the care? We know that with COVID, we now have nurse practitioners and PAs in a better position to do things like sign physician orders. You want to make sure that you know that up front, because if you don't get that, it could disrupt the ability to provide care consistently and also get the things that you need to be able to keep the cash flow coming in a timely basis to care for those patients. Look as a part of that at what processes, that involve action by outside stakeholders. You know, orders management is a huge issue right now. Physicians are not accessible, you know, so we aren't able to get signatures on orders as quickly as possible. We're not able to get even callbacks from doctors' offices and the people that work there because they're not in a regular routine. They don't have all of their staff in the office. These are things that will affect you not only from the standpoint of having verbal orders backed up by a signature, but the ability to bill. And for those of you who are in Texas, I don't think anybody really needs me to go into the whole pre-claim review impact because you're feeling it right now. But I will just say, if you aren't looking at your processes for the things that involve outside stakeholders, you are going to have problems with pre-claim review if you're not already in it. We know that some agencies paused during the waiver period, and they've been able to stop submitting for pre-claim review, which may have helped, but that's coming back in a couple of weeks, and you will not be able to, you know, to go without getting some of these things done before you submit for pre-claim review. Now, we also want to look at minimizing unexpected or early discharges. You know, the inability to see patients has had an impact on this, as well as patients that just decide they have too many concerns about someone coming into their house. So what you want to do is look at what trends do you have and how do you try to get ahead of that by communication with the patient and family members, by doing things to try to make them feel comfortable that they don't need to tell the agency, I just can't have you in my home anymore. Then when you're talking about hospice, look at those level of care changes and make sure that you know that it's being done properly and that the documentation is being done well. because inappropriate activity in this area can have a significant impact on your cash flow, and you don't want that to happen if you're a hospice agency, because that's when you really start seeing a very big impact on cash flow. Then just look at any additional processes that may have a negative impact on your ability to have that money coming in the door. You know, we know that there are revenue losses, there are delays with cash flow for different reasons, and if you are not able to get the revenue, like I said, you're not even going to be able to cover the costs that you've put in up to that point. So you're in effect upside down, and you have to make that money up on another case in order to be able to cover the care for the case that you are looking at that point. Looking also at, you know, I talked briefly about outsourcing things potentially like your policies and procedures, emergency preparedness plan. Look at what else you can do to potentially outsource things that are not being done well because you can't focus on them right now. You know, I realize that outsourcing costs money, but if you find that you can get these things done and you know that they're taken care of and you're able to really focus on running your business more efficiently to bring money in the door, you're more than covering your costs to do that. So it's just something to think about. And then also looking at what is the process that you have for documenting all of the things that you're doing, and what are the potential survey deficiencies that you may have, because some of those deficiencies are going to come with administrative fines. And when you're talking about administrative fines, you're just giving money away. If you don't have to, you know, avoid that deficiency and don't have to write that check, you know, when you get down to it. Now, as far as the clinical impacts go, you know, think about having routine virtual staff meetings. We know that we can't do in-person meetings as easily right now, especially in certain areas. Look at how you can do that virtually to share the PHE information as well as infection prevention updates in particular. You know, you need to talk about what's the need to know information. Talk about that right off the bat. You know, give it the staff information on what your staffing plan is. You know, the unknown is one of the most difficult things for people. If they have some sense of I'm being kept informed, they are going to be far less anxious and have, you know, far less concern about what's going on because they feel like the agency has it under control. When we talk about the stress associated with this pandemic, the unknown is a big factor in that. And for staff, if they're not sure if they're going to have a job next week, or if they're not sure that they're going to have a job, but they're going to be doing the job of 3 other people, you know, because you're running short on staff, that's going to cause a whole cascade of stress responses, which then leads to a lot of the burnout and the fatigue that we've talked about already. You know, allow the staff to ask questions, express their frustrations, you know, and ask them to bring, you know, potential solutions. You know, I always say you don't want people to just bring a problem, you want them to bring a solution along with it. You may not be able to implement it or implement it exactly the way they want, but at least they're trying to help problem solve. Then you want to look at how to encourage patient and family members with feedback and success stories, and the staff are a part of that. They're the ones seeing them firsthand, and they can help with that. Then how do you communicate that staff to that information, to remote staff who don't come to the agency on a regular basis, especially in a PAS agency? You know, we talk with people who say, I have 300 attendants. You know, I can't have them come into the office for a meeting. Well, you have to, you know, again, think outside that proverbial box, and how are you going to communicate that to them and know that they have, you know, gotten that information and have some level of understanding like you need them to. Then look at how are you going to increase that psychosocial discipline support for the patients, clients, and families. You know, look for virtual opportunities to do things that reassure them about the safety of care. Coaching on how to do that for the staff. Looking at how they are going to be competency for those skills that you need to make sure that they have when it comes to that type of support. And even just how to conduct an effective telehealth visit in case they're doing that type of service. You know, whenever we are doing all of these things, then what you'll find is that you really are, you know, trying to hit on all those things, not only in keeping your staff informed, but at the same time, making sure that your staff can then go out and share that with the patients, clients, and their families. All right, Amy, can we do the third polling question right now?
Yep, let me get that pulled up.
Okay, so our third and final polling question is, how has your agency's census been impacted by the COVID-19 pandemic? So the choices are very little, which would effectively be about a less than 10% census loss. Somewhat affected, which we're kind of measuring as a 10 to 25% census loss. A moderate impact, which would be 25 to 50%. And then what we would consider to be a significant impact, which is where you've had a greater than 50% census loss as a result of the things that we've been talking about today. So please, if you would, if you don't mind sharing, let us know. And again, this is anonymous, so even if you tell us we're not going to know who you are, we'd really like to know how agencies are seeing an impact from this, because with all the things that we've talked about, we know that these are having an impact on agencies and could potentially be a big impact.
Looks like everybody's about done. Let me go ahead and share that for you.
Okay. Okay, so in general, it looks like the bulk of the agencies have had anywhere from 10 to 25% or 25 to 50% loss. So I actually think that's pretty notable, especially those of you, about a third of the people voting have said that they have had about a 25 to 50% census loss. When you consider what you budgeted for using that, the starting census at the beginning of the year, I'm guessing that that's having a big impact on your agency, even if you're still below 50%. So thank you for contributing to that. All right, so we do want to answer any questions that we have, but before we do that, we just wanted to provide to you, for those of us who've been presenting today, we are here to assist you if you have questions. And to help you throughout this public health emergency. We have our websites up here. The Healthcare Consult Link website does also have access directly to the Pandemic Recovery Series webpage. And you can contact us directly using the email addresses at the bottom of the screen and the phone number for HCL. Now, our final session is next week, like I mentioned early in today's session. We're going to be optimizing external opportunities for agency growth and expansion and talking about that. If you need registration support, you can go to the website to register. And if you have any problems, the number and the email for how to get assistance with that are listed here. And then again, we have the webinar series website shown so that you have that. All right, why don't we look, Amy, at the Q&A?
Yeah, there's not many questions. The one is, how will we get the recorded webinars? And that is that there will be a follow-up email that'll go out tomorrow, and it'll have a link back to the website that Charity was just mentioning, which will have the recording posted and the slide deck posted as well.
Yes. And the other question that we have is, in Texas, aren't they allowing families to visit again in facilities in the hospitals? I will tell you that is very facility specific. There are facilities that have opened it up more. I will tell you from personal experience in the last week, I've been unable to visit a family member who was in the hospital because of COVID. There were very strict limitations on who could come in or how many people could come in. And, we were in a position where we had to ask for an exception because of the circumstances, and we were allowed to have 2 people in. But even that was a stretch. So it really is very dependent upon the facility as well as, their guidelines, for trying to control the spread. Some of the facilities that may have opened it up at some point are backing off again based on what we're seeing, simply because maybe they didn't have any COVID cases. And once they started letting family in, even with the screening procedures and the protective measures, they started getting cases, so they've actually backed off again in a few cases that we know of. So,
That's
do we have any other? Oh, go ahead.
No, I was going to say that's all I show for questions.
Okay. All right. So if we don't have any further questions, I think we can wrap for today. We do hope that everyone has enjoyed today's presentation and that you'll join us next week. And do let us know if you have any questions after the fact. And again, the slides and the recordings are on the webpage, and we encourage you to visit that. So thanks for joining today.
Thanks, Charity.
Thank you.